welcome.
Welcome to you, New.
Thank you, Connie. I appreciate that. We want to welcome everyone. I know folks are still kind of coming in here, so I'm going to give everybody a Zoom second, right? Or two.
Okay,
Yeah, it's nice to see all of you as well.
Oh,
well, thank you. Thank you. 2 months went by really fast. I really see that. We want to welcome everyone. We're here starting with our partnership HTO Healthier Together Oregon meeting this afternoon. I want to welcome everybody to our March meeting. If you can believe we're already into March. My name's New Toe Haynes. I go by she, her pronouns. I'm your facilitator for this meeting. I want to say thank you to all the folks who have welcomed me back in this process of being the facilitator for this meeting. I'm going to pause for a second and encourage folks before we get started to select the channel in which you want to listen on and participate this afternoon. And I'm going to give our Spanish interpreter the opportunity to translate that, to interpret that real quick before we switch channels.
Buenos días, primero que nada les damos la bienvenida a todos y les queremos comentar que va a haber servicios de interpretación simultánea disponibles. Si ven abajo en la pantalla en un momento van a ver un globo, ahí van a tener la opción de escoger el canal que ustedes prefieran. El canal de español va a estar disponible. Very new.
Thank you. So at the bottom, you'll see of the toolbar, you'll see interpretation. You'll want to select English if you're going to listen in English. You'll select Spanish if you're going to listen and participate in Spanish. So I'll give everybody a second to do that. I think we're set with our interpretation piece. Again, I want to welcome everybody. My name's New Toe Haynes. As I mentioned, I go by she, her pronouns. We're going to take some time to do introductions with our team here. Real quickly, I do want to mention that this afternoon's session, we will not be taking any public comment. If you're part of the public, we encourage you to go ahead and introduce yourself in the chat. Otherwise, I'm going to call on our different partnership members to do introductions this afternoon. So as part of your introduction, we encourage you to not only turn on your camera so we can see you, but also give us your name, which organization you're working with, and share your pronouns as well. And would anybody like to get us started this afternoon before I start calling on names?
I can start. My name is Rachel. I'm with the Family Justice Center of Washington County, and my pronouns are she, her.
Thank you, Rachel. Connie, would you mind going next?
Hi. Why not? I'm Connie Dillinger, and I'm with All Care. I'm on the CAC, and I just call, you don't want to know my pronouns, so you don't.
Okay, thank you, Connie.
They're pretty X-rated. I'm going to call on Monica.
Thank you.
Everybody, Monica Yellow Owl. I work for the Klamath Tribe's behavioral health program known as Youth and Family Guidance Center. She and her.
Thank you, Monica. How about we go with Kurt?
Good afternoon, everyone. My name is Kurt Toomes. I'm the Chief Executive Officer for Eastern Oregon Center for Independent Living, pronouns he, him, his. It's good to see everyone. And yes, I cannot believe we're in March already. It's good to see you.
Thank you. Good to see you. Jennifer Little.
Hi there, Jennifer Little, she, hers. I'm from Klamath County Public Health.
Great. Thank you, Jennifer. And how about, I'm looking at my list here. Timur, is he on here yet?
Don't think so.
Okay. Amy. We'll go with Amy.
I just got here. Are we just
just introductions, Amy? Sorry. introductions, your name, which organization you're with, and your pronouns.
Okay, Amy Thurin, Healthcare Coalition of Southern Oregon, she, her, hers.
Thank you. Ian, if you don't mind going next.
Hi, everyone. My name is Ian Winbrock, and I use he, him, his pronouns, and I'm here as a representative from the Whitaker Community Council.
Great, thank you. Let's see. Alicia, are you here yet?
Mm-mm.
Oh, okay. Esther.
Hi, everyone. My name is Esther Kim. My pronouns are they, them, and I'm one of the co-directors of the Oregon Health Equity Alliance, which is a regional health equity coalition.
Thank you, Esther. I had a little hard time hearing you, so I don't know if it's the microphone or not.
Do you want me to do it again?
Oh, perfect. Thank you. Yes,
Oh,
please.
Okay, sure. Hi, everyone. Esther Kim. My pronouns are they, them, and I am a co-director of the Oregon Health Equity Alliance, which is a regional health equity coalition.
Thank you. Let's see. Kimberly, is Kimberly here? No. How about Jess or Jessie?
I'm Jessie, so I don't know if you mean me, maybe.
Jess Gasper. I'll introduce you in a bit, Jessie.
Okay, got it.
Jessie is one of our presenters this afternoon, so looking forward to it.
Thanks.
I thought Jess was on for a second, but maybe he had to rejoin.
Okay. Stan, we're doing introductions real quick. Go ahead. Oh, you're on mute, Stan.
I do that kind of a lot. Anyway, I'm Stan Baker and PartnerSHIP, and it's great to see all you guys today.
Thank you. Alicia, if you don't mind going next.
Oh, hi. I'm Alicia Overstreet. I am part of the PartnerSHIP, and I sit on several of the subcommittees.
Thank you, Alicia. Good to see you. And then I'm looking at my list here, folks. I don't see Talk and Veronica. Did I?
No, not yet. I know she was juggling baby today, so she might be late.
Well, that's a handful when you're juggling baby. All right. Dalia. Have we seen Dalia? Nope. Okay. Was there anybody I missed who is part of the PartnerSHIP membership? I want to make sure.
Tamur joined us.
Oh, perfect. Tamur, please. We're introducing ourselves with pronouns and then also the organization that we work with.
Yes, hello, everyone. This is Timur Holov with the Slavic Community Center of Northwest, and my pronouns are he, his, him.
Great, thank you. I know Susan Blaine of Peace Health will be joining us at 2 o'clock. So I'll just make mention that she'll be joining us. We have several different guest speakers who will introduce in just a bit here. I really wanted to welcome everyone, and in the spirit of just taking time to hold space for one another, I would encourage folks to, we're experiencing a lot of stress and trauma in our lives right now, and it makes sense that if you're not in that capacity to be fully productive in whatever that means, we encourage you to take time with this process and listen in and share what you want to share. I come from a background where being productive is really important. And I've just learned in the last 2, maybe even 5 years that productivity isn't always necessary and isn't always as healthy for us as we might think, but it's something that I kind of revert back to. So I would encourage us in the space of being together, that we encourage each other to be productive in whatever that feels like, and for you and yourself, right? So thank you. We want to open to give ourselves opportunity to share with one another any type of announcements that folks want to make. We want to do it sooner rather than towards the end when we may be running out of time. So in the next few minutes, we're going to just give each other opportunity to make any announcements that you have, whether your organization or other announcements that you want to share with the partnership. So we're going to open it up for folks to do that.
Well, okay. If I start off here.
Yes,
New?
Stan, please.
New, it's so great to see you again. I can't begin to tell you how happy I am that you're facilitating. You're a tremendous leader, and great to see you.
Thank you.
This past 6 or 8 months with the pandemic and all, our business has really been growing exponentially because people are staying home and planting gardens, and they're planting lawns, and they're doing things at home rather than traveling. So the last 3 or 4 months, it's been a challenge to be able to engage as much as I'd like to in the partnership. And so I've had to make the difficult decision that I need to pull back from the partnership for a while. It's been a great experience and a great group. I would like to say a few things as far as maybe toward the future of the partnership, because I think partnership is uniquely positioned to make a tremendous difference in Oregon going forward. Don't forget that climate change is real, and it's impacting agriculture all across the world, and it's going to continue. With the war in Ukraine, 2 of the major exporters of grains, foods, agricultural products are now coming off the table, combined with oils almost tripled in price by the time this week is probably going to be happening. Inflation is with us, and the ones that get hit the toughest and the worst are the marginalized people, the people that are in poverty and are poor, those that it's easy to forget about. But these are the ones that are going to be facing the greatest challenge, in the partnership with the position that we have is in a place to be able to be a voice for those that do not have a voice, or for those that are on the sidelines. I'd also like to say that the priority populations are really important, but I'd also like to bring up that there's many poor Caucasians, especially throughout the rural areas, that don't have a voice, and they are dealing with issues and no internet and hunger issues. And so I'd like to at least bring up the partnership. At some point in time, you might consider the priority populations, to expand the priority populations, focusing on those that are in the greatest need. Those mental health issues knows no racial boundaries. Hunger knows no racial boundaries. I really believe in the work of the partnership. I really believe in the strength of each one of you. And I believe that the partnership is going to do great things in the days to come for the people of Oregon and in your communities. Thank you for the great opportunity I've had to serve with you. Thank you for the opportunity to be on the guidance committee and to see a few times the policy committee and the finance committee. Need to have a communications committee going here pretty soon as well. But I want to say thank you. I believe in you, and I'm not going to be disappearing from time to time. I'll be listening in on the partnership meetings, and you guys don't know my email. So anyway, thank you, and I wish you all good success, which I know you're going to have.
Thank you, Stan. It's just been a pleasure working with you in this last year, and for your ongoing efforts with really stepping forward and really helping to lead this group. You will be sorely missed in a lot of different ways, and so I appreciate your time and all the work that you've been doing. Alicia, please.
Yes, I just want to echo what New just said. Stan, I think you and I, we've been very vocal about the rural population, and I absolutely appreciate your voice on the partnership as well, and you will definitely be missed. And yeah, so what are we gonna do now in the guidance committee? Really? No, but I hope, I hope only good comes your way.
Thank you.
Any other announcements we'd like to make? I want to just comment real quickly that as we are sharing, our closed captioner is trying to record everything. So use real loud voices if we can, and then at a nice steady pace for our closed captioner. Christy, did you have some announcements you want to share?
I do. I also see Ian might have an announcement.
Oh, please, Ian. Sorry, I didn't see your hand.
Yeah, I just wanted to echo what New and Alicia said. I probably can't say it better than them, but just really appreciate you, Stan, and the voice that you've carried through and your leadership throughout this. Really gonna miss you, but you're not gonna be a stranger for sure. You're tough acts to follow, so I'll keep it relatively short. The Whitaker Community Council has been selected as one of 30 organizations to do art that improves vaccine confidence, both in seasonal flu vaccines and COVID-19 vaccines. And we've chosen to do some really cool projects that I'm super excited to share with y'all. We're going to do 10 different mural intersection murals, so at actual street intersections and at crosswalks. And we've just had the call to artists finish, and they're super cool. Can't wait to share all these amazing potential murals. And if you're in Lane County during the summertime, feel free to join us for the painting parties that are going to come around. We're hopefully going to paint the murals with community-based organizations that are reflected both in the murals and are proximate to where they're at. So lots of cool intersections of art and public health, pun intended. And if y'all are interested in it, I can send you the art that's been approved by our partners at the City of Eugene and the CDC as they start to come online.
Fantastic. Congratulations to Whitaker community. Thank you, Ian, for sharing that. Great news. Any other announcements from partnership members? We have a couple more minutes we can devote to this.
I'll announce here at the Family Justice Center, we are getting geared up for April, which is Child Abuse Prevention Month, and it is also Sexual Assault Awareness Month, but we're titling it Sexual Assault Action Month. For those that don't know, Oregon has a higher than the national average rate of domestic violence and sexual assault and rape in this state, and so we are trying to unite our whole county to do proclamations as well as public information campaigns. And we will be hosting a survivor art gallery here at our center to celebrate that, as well as survivor voices. But it's a good opportunity to continue to raise awareness around violence and abuse in Oregon, which is sadly quite high.
Thank you, Rachel, for letting us know that. Yeah. Christy, I'm going to turn it over to you for a couple announcements, and then we'll move forward.
Yeah, sounds great. I've got 3 things for you all today. The first is just to put a plug in for the partnership survey that we shared a link to in the HTO update. We've only had 6 people respond to that and would love to see more people respond. It's really helpful feedback for us and for New now that she's back with us, and just provides really good information about how you are all doing out there and feeling about this work. So please do take that if you haven't yet already. I will drop a link to that in the chat here in a second. The second thing is in regards to May. We are planning for an in-person meeting, which is super exciting. We've got a room reserved at the Portland State Office building. And I know there were a lot of people out there who were hoping for a remote option. We have been discussing that here at OHA and have decided not to offer a remote option at this time. Just logistically, it was going to be really challenging, particularly for those of you who are looking for accommodations around accessibility in the meeting. We really want to make this an engaging opportunity for us to actually come together and get to know each other. And so we are not going to be offering that remote option. If you have concerns about that, you can direct those to New. We'd be happy to talk with you about that. So do plan on the in-person meeting. Travel is reimbursable. So we will be covering flight and mileage. If you want to fly, I know some of you will be coming quite a distance. Happy to get you on a plane, or at least pay for your miles, hotel accommodation, meals, all of that will be covered, and we'll provide more information about that this week for those of you who will need to be spending the night. Hours are 9 to 3, but depending on the agenda, it might not be that long, but we're really excited to see you in person and hope that you can all make it. And then the third thing I wanted to share is that the Funding and Finance Committee met on Friday and have decided to allocate some of the block grant to support your participation in the Collective Impact virtual convening. The Collective Impact Forum is a national organization that provides whole sorts of trainings and capacity building around the collective impact model. Their conference is amazing. And their virtual conference is coming up April 26th through 28th. And so any partnership member that is interested in attending, we will cover that. The early bird registration ends this Friday. So if you can make a commitment about that before the end of the week, that would be great. And yeah, we hope that those who are able to attend that conference would then bring back some of that learning and sharing to the May in-person meeting that would follow right after that conference. So look for more information about that. And I will also drop a link to that conference information in the chat if you want to take a look at who's going to be there.
And it looks like we have a couple questions, perhaps. Alicia and then Kurt, please.
Yeah, I was just wondering if the piece around the challenge with having a hybrid option and the accessibility piece to it, if that's something we could maybe talk about or address at the guidance committee or when we meet as a guidance committee, so that, you know, learning from the issues or the problems that or the barriers that we ran into now, so that next time this can be kind of remedied so that we can make it accessible for everyone to join.
Yeah, for sure, Alicia. I would love to hear about that. And, you know, we've got some time too. So if there are particular challenges that you have with getting to this meeting in person, we want to hear about that, know about that, and see if we can come up with a solution that works for everybody.
Yeah, let's go with Kurt, your comment, and then Esther.
Hi, Christy. I cannot recall if I completed that survey, so I'm wondering if you could send out an email just giving us a heads up if we did or did not complete the survey.
I don't know if you completed it because it's all anonymous.
Well, I believe I did.
You can certainly click on it. I'm sure it'll, you know, you'll be like, oh yeah, this is familiar, or it's not familiar. And if you want to take it again, it's okay. I don't think it'll, you know, all of that information is helpful. So
thank you, Christy.
Yes.
Go ahead, Esther.
Thanks, Neil. I have to say, I'm pretty disappointed that there's not going to be a remote option for the next partnership meeting. I think that's a real problem. And I think if we're not leading this work with access, then I mean, I have a lot of flags about this. So no, I will reach out to you, but I just wanted to say that in front of the group. So
great. Thank you for that. And I do encourage folks to reach out to me as the facilitator. We want to remind folks that I am not a staff member with Oregon Health Authority, who is the lead agency who's working behind this. You all are the leads, right? And so if anything comes up, you know, please reach out to me. I'm happy to take all of that and then bring that to the guidance committee as well, and then look at ways that we can better accommodate folks. So yes, please reach out to me, and I'll be doing follow-up calls to everyone later this week just to connect as I kind of transition back into the position of facilitator. So happy to have those conversations with you folks. And this is for our May meeting, so we do have time to work something out if necessary. With that, I'm going to go ahead and transition us into our next piece. We're going to be hearing from our director's office, our deputy director, Kara Biddlecom, and then we also have one of our policy leads, Sharina Walker, to share with us on resilience plan for COVID. So Kara, I'm going to turn it over to you.
Sure. Hi, good afternoon. I'm Kara Biddlecombe. I use she, her, and hers pronouns. New, thank you for introducing me. There aren't materials in your meeting packet about what I'll speak to this afternoon, as this is just kind of teeing up, I think, future conversations. But I actually think that the last conversation was a nice bridge into that, whether you knew you were making that bridge or not. So as I think many of you know, we're preparing due to the decrease in COVID-19 cases over the last several weeks to remove the requirement for indoor mask use starting at 11:59 on Friday, both in indoor settings as well as K through 12 settings, and also making some changes to quarantine requirements. And so this brings OHA and our many partners to a really important time, I think, as we look forward in the response. And that's that we know that there are many health issues, many social issues that have been exacerbated by the pandemic, which exacerbated still other health and social issues over time. And so where we're wanting to focus for the next year and a half or so really bends us back into the work that you all have been leading on the on Healthier Together Oregon. So what OHA will be doing in partnership with the governor's office is kind of releasing a plan over the next several days for kind of looking into the future, how we actually start to address COVID-19, make sure that we are not leaving aside all of the equity gains that have been able to happen with intentional focus for the last several months in the response, and also look at what communities need and how we start to implement more robustly the types of strategies that have come up in Healthier Together Oregon, and hopefully leverage your leadership and your thoughtfulness around doing that. So to that end, I think that as we've been having conversations with community-based organizations, community members, local public health, and continuing those, the focus areas that have continuously come up again are the same ones that you all have prioritized for Healthier Together Oregon. And I would say two that, kind of above all are around housing needs and behavioral health services. And so as we look forward to engaging in a more intentional way over the next several months, what would that look like for HTO and for the partnership to be able to kind of both customize and hear what community's saying in this space of looking beyond COVID and in terms of the other health and social impacts, and then how would you all like to have a role in supporting that? So that was a lot, and I'm happy to just sort of answer questions about where we are today, but I really just want to hear from you all about how we can help to build more of these connections around a framework for COVID-19 resiliency.
What questions do folks have for Kara and her team? Esther, please.
Kara, thanks for sharing that. I am curious as responses to COVID shift, specifically around the mask mandate, and then I believe that this is I think that we're already sort of in a place where contact tracing has lessened and access to testing has lessened. What is OHA's position on the fact that so people will not be wearing masks inside, more than likely the spread of COVID will continue, but there won't be the infrastructure to track it. Are you all thinking about what the sort of pitfall of that is going to be, or how to prepare for that? Because people will continue to get sick, and also I'm curious about how you're tracking or preparing for hospital capacities as well, or thinking about that as far as the larger infrastructure.
Thanks, Esther. That's a really important piece that I didn't speak enough to. So I think there are, as I look at the next, let's just say, year and a half, the most immediate piece, I want to be clear that OHA isn't walking away from COVID-19, but we are trying to transition the response to where we are today with what we know needs to happen for communities, but very specifically focused on health equity and focused on populations that we know have been disproportionately impacted by COVID, and by way of all the things that you mentioned. So particularly looking at our data, so collecting enough data so that we can understand in real time where we're having community impacts, so that communities can be resourced, whether that be with treatments, vaccine testing, et cetera. But then also, how do we look at kind of all of the other things that quite honestly have also been worsened by the pandemic, where we also need to focus. So I think you brought up some really important pieces that are, in my mind, acutely important as we move to the next stages of masks coming off in public settings and what those impacts are going to be to communities. And then also how we can continue to support that work, again, focused in the equity impacts that we know this virus has had, to also wrap around the other healthcare and social services that we know that communities need. So these are all really important pieces, Esther, that we'll make sure and bring into planning and be able to communicate back out as priorities.
Ian, please go ahead.
Yeah, thank you so much for joining us. And I just wanted to also say thanks for your personal tireless advocacy of getting funding to community-based organizations. I think as we transition from response to recovery and still look for the disproportionate communities that are going to continue to be hit hardest by COVID, I'm wondering how we might be able to look at the work that y'all have done around public health modernization and kind of really subsume that or help that guide us, particularly as we look for public health modernization within the context of CHIP updates for different counties and how we might crosswalk CHIP updates with public health modernization. So I'm just tossing to everyone a little link. And again, my view is so winnowed and kind of, I've got big blinders on, but the funding opportunity for community-based organizations that OHA put out last month, where applications were due at the end of January, I think is a really interesting opportunity for HTO to look at public health modernization as a way to continue those equity gains and health equity focus specifically, but particularly how we might be able to elevate best practices and alignment between community-based organizations and the longstanding relationships at the county levels for advancing not just public health modernization, but HTO as well. And so I know that's kind of a convoluted mess of a statement, but I think there's a real opportunity here to look at public health modernization, the work that y'all have funded, and COVID recovery. So that's kind of something that I'm really interested in, is looking at CHIP updates and the public health modernization work that you funded, and see how we might be able to look at those best practices and relationships from an HTO level over the coming months and years.
I like how you were thinking ahead, Ian, because much of our conversation this afternoon is going to be looking at, potential and future policy option packages. And so even connecting all of that together, I think is really a good part and transition to the conversation. Do we have any other additional questions for Kara and what she's asking of this group, or thoughts that we want to share before we move on to our next piece that's connected to this? Timur, go ahead.
Yes, I have a question or maybe a suggestion. So because of the thing that's happening in Ukraine, I think that we also need to somehow think ahead and prepare for refugees that might be coming to Oregon. I know that there are organizations that are working on opening up a pathway for thousands of potential people that could be coming here. So I don't know if we can somehow include it. I know that when we first started, we were talking about also including, Slavic group into the original document. but we kind of, backed down on that a little bit. But and I also know that we just kind of got finished with the Afghani refugees as well. But just throw it out there if there's a way. I know there's going to be a lot of young people coming, lots of families and things like that. So let's not forget about that as well.
Thank you, Tamir. And I think part of PartnerSHIP's population base included refugees within our statement too. So thank you for reminding us and getting us back to that piece of looking at who our population is. Veronica, I see that you have your hand up. Go ahead.
Thank you. Thank you, Kara, for coming to the meeting. I think I would encourage OHA to think about in this transition how with all of the organizations whose capacity was built by providing the wraparound services, community outreach, and engagement services, as we transition into recovery and after COVID. I hesitate to say that because it's so tenuous. But how can we continue to support those organizations so we don't lose all of the infrastructure that they were able to build through that work? And that might be tricky because there might be funding gaps between like what is available now and what might be available in the future. If OHA can think about, are there ways to transition or find gap funding so that if you know that you want to continue to support them in the future, how can you provide some gap funding so that they don't lose the infrastructure and then have to rebuild it again once the next step in the process has been figured out? Thank you.
Thank you, Veronica. Rachel, please.
Hi, Veronica. Thank you for saying that. Very good point. I don't exactly know how to put into words what I want to say, but potentially you are. And I wonder if you guys are taking a look at sort of what fell apart during COVID in terms of infrastructure, and then what do we need to strengthen so that it doesn't fall apart again. And I'm just sort of reflecting on like, when the pandemic hit, it was like dominoes. Like the United States fell apart in like a week and a half. And that was wild for all of us to see. And it was like, I just remember being struck over and over and over again about how not resilient we were in any way. Like none of our systems were resilient and they all fell apart. And so I wonder if you guys are taking a look at like what fell apart, and then how do we make sure that it doesn't fall apart again? Because I think that was the biggest pain in this pandemic, is that so much stuff that we thought we could count on, we couldn't. And then we just sort of had to patch it together. And then all the things that were, and you already are, and I'm very proud that Oregon put such an emphasis on this, but all the things that were exposed and exacerbated by the pandemic to the general population, not that they weren't there before, they were, they just became obvious and front page news, I suppose. And so making sure that those aren't forgotten. And then I had one more and I completely forgot it. Oh, and this one, I apologize. I don't know how to make this sound correct. And so I apologize for just saying it the way I'm thinking it, but it turns out there was a lot of money to help these issues out. And it was very quickly distributed, and that's wonderful. And how do we make sure that that money doesn't go away? So when we talk about making sure that we're strengthening those organizations that built up all this capacity, or we're talking about all of the systems that got put in place to respond to this emergency, how do we keep all of that going to make sure that it's actually sustained? And yeah, maybe we need to reevaluate the priorities and things like that. But I think one of the flip sides of being able to pump all of this money into the community is that sort of now we know we can do that. We can pump money into social safety net services. And so how do we make sure that that tap doesn't turn off? And that could be very ignorant because maybe I don't know where the money came from, but on the face of it, it looks like we had it there. And so maybe we shouldn't get rid of it.
Great, thank you, Rachel. Thank you so much. I think that goes along with some of the comments from colleagues within the chat as well about just continuing to be able to fund the community-based organizations to the level that they have been funded in the last couple of years. I think there was over 170 CBOs around the state that OHA was able to help continue to offer additional funds during COVID times. We are running out of time on this topic. Kara, would you like for folks to send you any additional comments through email, or do you have what you need at this time and maybe come back? Or how would you like folks to follow up?
New, this is Kara, and first I just want to appreciate all of the comments that everyone made. They're really rich and hit to a variety of ways that we need to be looking at this. Just briefly to Rachel's question, we actually will be doing an COVID-19 after action report, actually a series of 3 reports with some legislation that just passed last week. So that piece will be coming. I also would love to hear from you, particularly around this space of thinking about community resiliency and linking it to Healthier Together Oregon by way of HTO has always been designed to be at, you know, a fairly high level, so that by that I just mean broad enough that community specific priorities can fall into it. And so how do you both want to hear from community perhaps to look at HTO priorities, but also how can those things kind of work together? Because I do think that when we are talking about resilience, we have an opportunity to support that culturally and community specific work that happens in between communities and these kind of broad statewide policy strategies. So I'm certain we'll keep talking, and with that I'll say thank you and then turn it back over to you.
Great, thank you, Kara. Thank you, everyone. We are moving into our next topic, which is around the Healthy Together Oregon policy option package. We have some information about that. I apologize, I'm a little rusty. I'm already 15 minutes behind. So I'm trying not to look at the time and be so time oriented and all of that. So I apologize. We will take our break. So please hold on to that bit of morsel, knowing that you'll get a break. So I'm turning this one over to, is it Sharina or is it Christy? Let's see.
I'll get it started first.
Okay, thank you.
Sharina, I can turn it over to you. So I hope you all saw a couple of weeks ago now in your Friday update, we shared information that we had been invited and asked to develop a policy option package to support Healthier Together Oregon. So this is really exciting, historic news. So it's great news, and we don't have a lot of time to put this together. We need to have a full package to OHA by July 1. And this is in parallel to the legislative concept process, which is those 7 priorities or 7 strategies that you all prioritized in December. We have also passed those along to OHA's legislative equity team to consider in developing legislative concepts for the 23 session. So we have both HTO legislative concepts, and we have now an HTO POP, and both of those things are different, but can be supportive of one another. So I thought it would be helpful today just to hear a little bit more about the differences between legislative concepts and POPs. I am still getting my head around both of these things. So really excited that Sharina is here to walk us through that. Sharina, do you want me to pull up the slides? Would that be helpful? Okay.
Yeah, thank you, Christy. That would be super helpful. Maybe I'll introduce myself while you're doing that. So hello, everyone. I'm Sharina Walker. I am the Public Health Division's Legislative Policy Lead, and I see a lot of familiar faces on here. It's nice to see everyone. Some of you I've worked with in the past or am currently working with in various different ways. So thanks for having me. And so, yeah, I thought I would just go over a little bit. I know we're kind of running a few minutes behind, so I don't think this will take too long to just talk about the differences between legislative concepts and policy option packages. I know that probably most of you or many of you know what this is, and this is, you know, basic information, but I just want to make sure everyone's on the same page because it can be kind of confusing. And if Kara, I mess up, you can jump in, and because sometimes it's confusing for me too, to be completely honest. So, but I'm actually wondering, I know you have in this slide, Christy, the last bullet point about the legislative equity team. I actually think I'm just going to say something about that real quick, and then I'll go into the difference between the legislative concepts and the POPs. And so OHA currently has put together a legislative equity team, and so it's across divisions, and there's certain people from each division who are participating on that. I'm participating on that as well, and so this group has really come together to kind of help further us in driving community-led legislative concept and policy option package development. And so it's a lot of work. We're doing what we can to make this happen right now. Currently, you know, because the timeline is so short, the group is really looking to a lot of community engagement and feedback documents that currently exist, because community has told OHA many times through many different ways, you know, what are the issues and what could be helpful, what, you know, legislative changes could be made. And so that's currently happening. And I have taken the 7 prioritized strategies and I have brought that to the legislative equity team, and we're helping to use that as kind of a framework in developing legislative concepts and policy option packages. But the work is pretty slow. I'm just being honest and transparent here. It's hopefully I can bring something back to you soon and talk a little bit more about that, but that's kind of where we're at now. All right, so legislative concepts. So legislative concepts are basically an idea that is put forward to hopefully become a bill that could possibly change a state law, provide requirements for an agency, or establish a new program. So this is really change in law. The concept itself is, you know, it's may or may not become a bill. So it's kind of the idea behind that. And it can be introduced by state agencies or legislators. So community could go to a legislator and then they could put forward a legislative concept through that avenue as well. And the legislative concepts may or may not have a fiscal impact or cost associated. And let's see here. What else can I say about legislative concepts? I think maybe the next slide has some examples, so maybe that will be helpful. Thank you. So these are examples of legislative concepts that did become bills. And so the first one is House Bill 4004, which requires Oregon Health Authority to distribute grants to behavioral health treatment providers for staff compensation and workforce retention and recruitment. The next one, Senate Bill 4092, modifies composition and duties of Oregon Broadband Advisory Council. I probably don't need to read all of this to you. These are just examples of legislative concepts that have become bills. Next slide. So policy option packages, these are different than legislative concepts, although you could have a legislative concept and a policy option package kind of together. And so policy option packages are formal budget requests to the governor, that are put to get forward. Like, for example, you know, Public Health Division puts forward public health modernization as a policy option package. And then we're going to be talking today about Healthier Together Oregon and that policy option package. And it asks for money for a 2-year period, although it could be ongoing work, but the money is allocated for that 2-year period. And POPs, typically, they are asking for money to resource staffing, grants, and contracts. It could be technology training and partnership development. So it could be a variety of things that you're asking for a POP. And so the partnership has been invited to develop a POP to support Healthier Together Oregon implementation. And so I think that's what we're going to be talking about today. And let's see here. I think, is there another slide on this one, Christy? Oh yeah, there is. Thank you. So I mentioned these before, just examples of policy option packages. And so public health modernization is an example, and it's for local, tribal, and state public health infrastructure. In 2017, there was $5 million, 2019, 15 million, 21, 60 million. So as you can see, the ask and the award has gone up over the years. And then Family Connects, another example of a policy option package, establishes universal home visiting program. And as you can see, the dollar amounts are listed there. So I'm wondering if anyone has any questions about POPs or LCs. I know that I was like spitting a lot of information out there, and I know it can kind of be confusing. Hi, Jennifer. It's nice to see you. I see your hand up.
Hey, good to see you too. And maybe you're going to cover this, but so I'm just a little unclear on who would carry this policy option package. Would it be part of the OHA Public Health Division, or is it like a separate OHA, like our group would have a separate one than the Public Health Division?
And I think the Public Health Division would put it forward. So I think this group would help kind of develop it. And then I think Christy can probably speak more to that than I can. And then the Public Health Division would put it forward.
Okay, so yeah, I just didn't know if it was like part of this would be like a component of the POP that OHA would be putting forward, or if there would be like multiple. That's just what I wasn't clear about. Thanks.
Yeah, this will just be one of maybe many policy option packages that the Public Health Division will put forward. So this one is specific to Healthier Together Oregon.
Do we want to give the example that folks from OHA had the dream session piece on, Christy? That might be a good transition. Either of you.
I'll pass it back over to Christy for this piece. Thanks, everyone.
Thank you, Sharina.
Thank you, Sharina. Yeah, so like I said, we, in order to propose this formally to OHA, we need to have this kind of document, and there's a big template and questions that need to be answered by July 1. So that gives us like less than 4 months. Just in like, as an example, I think like the public health modernization POP, like they knew that was going to be happening like last summer they started this conversation. So in an ideal world, we would have had a lot more time and been able to really step back and let you all lead the dreaming of what you want this to be. I brought this forward to the policy committee to get this started last week, and talked a little bit about the differences between LCs and POPs and how this can support, but also be different than the legislative concept process. And shared that there was this kind of dream proposal that a few of us in OHA and public health put together last year at the request of Director Rachel Banks. And so it just, basically the guidance from the policy committee was like, I think it's better at this point just to give us something to react to. And so the dream proposal that is in your meeting packet basically is that proposal and outlines an ask and requests within staffing, additional staff to support this work. It asks for money for communications. It asks for money to put out through contracts and grants to implement this work through community, namely community health improvement plans, and asks for additional resources related to data and evaluation. So there's a 2-ish page document in your meeting packet. Really, this is something for you all to react to. You can take this thing up and put it in the shredder if you want. No hard feelings, but we would like to get your thoughts today on whether or not, yes, that this is the right direction to go, or no, this isn't going to work. We need to take a different turn here. And it's on page 13 and 14 are the details if you want to take a look at what a few of us dreamed about. I'm happy to answer any questions about that too.
And while folks are thinking about that, I know we didn't give a lot of time for question and answer on this particular section, and I apologize for that. I think it's important to take it as this is an idea, right? And so this is how big you could dream of it. And I think that's the part that was exciting as I read through the proposal, as the dream proposal, right? So you as a body, the partnership can really dream pretty big based on what I'm seeing here being laid out. And so I think that if you take some time to look through it, you know, how big do you want to dream? I think that's the exciting piece of this. Do folks have any comments as they're looking through it, thoughts?
Rachel?
Just a quick question about how big can we dream? What's the cap on the dream and how likely is the dream to come true?
Great question. Kara, do you have any like number estimates?
This is Kara. I mean, we haven't put something like this through before. So I think start with what you feel like the work needs. I would, be realistic that this is a 2-year time period, and just keep that piece in mind. In terms of reality, I mean, I don't know. I can say that the work of Healthier Together Oregon connects to everything, and it connects to many of the state's priorities, but also, quite honestly, our governor will change, and we don't know what that looks like in this time period ahead of us. And so that could have an impact based on what that governor's priorities are and what they would like to see, which I guess the one thing I would add to what Sharina was sharing about this coming through the Oregon Health Authority is that, there are other ways to introduce bills and funding should the partnership separate from OHA wish to pursue other avenues like that. And I know that's something that the policy committees started to talk about some. So that's my, I really have no idea kind of answer, but the most truthful one I can give you for right now.
Thanks, Kara. Kurt, please.
Thank you. Christy, I'm looking at the dream proposal right now, and I'm not seeing a placeholder for the grants contracts for implementation. Am I missing that, or is it intentionally not in there?
No, it's in there. It's on the second page here. I'll bring it up just to kind of show you. Do you see that now? Do you see that, Kurt?
I see it, but where's the dollar amount?
Oh, that is the yet to be determined.
Oh, okay.
I think that's kind of what we were hoping Kara would have an answer for, but yeah, those are some of the details that we need to work out between now and July.
Okay, and so these would be grants contracts filtered through to, or filtered out to maybe community-based organizations, CCOs, and hospitals to implement the state health improvement plan.
Yes, could
very
be.
good.
Could be.
Thank
That's
you.
one idea.
Very good. Thank you.
Do folks have thoughts about how they would like to move forward in assessing this? I know that this was sent out and people need to sometimes sit on it and let it marinate a little bit before having some thoughts. Do folks want to possibly ask one of the subcommittee groups, perhaps the funding committee, to take a look at this and offer some feedback? Or do you folks want to send that to OHA? Where's this sitting with folks? I want to get a feel for how people want to move forward. And there was a question from Marnie Jewel asking whether it's possible to add comments to this directly.
Yeah, and I could provide a Word document if people want to work with it that way. Mhm.
How about partnership members? Need some time to sit with it?
I'd like some time to sit with it. This is Connie.
Thank you, Connie. Ian, I see you have your hand up. Kurt, did you have your hand back up? I can't tell.
I do. I think we need to either send that back to the policy committee or somewhere to get a dollar amount assigned to the priorities that we've listed as partnership, right? We kind of need to know moving forward somewhere along this timeline what dollar amount is needed in each category to implement those priorities that we identified as for our SHIP.
Mm-hmm. Thanks, Kurt. And your suggestion being that it go back to the policy committee to look at that, or was it the finance committee? I apologize, I didn't catch that.
I don't have a preference. I guess that would be up to staff to decide which committee that would be appropriate.
Okay. And Ian, did you have a comment? I thought I saw your hand raised.
I just wanted to ask Christy what the internal timeline was to be able to get this through. I want to make sure that we all have an opportunity to get more comfortable, but I didn't want to miss a really important staff deadline.
Yeah. Yeah, so the big deadline we're working towards is July 1. And there is a timeline here in the meeting packet that I'll just pull up and give you a sense. I'll walk through this with y'all. So by end of March, really, we're hoping that we would have answered what resources and or policy changes are needed to achieve this goal. So that would really be like, you know, is this the thing? Are these the right categories that you all want to go for? If not, what else? And yeah, within a, you know, a specific dollar amount, what do you want to prioritize? Do you want most of that, if not all of that, to go out in contracts and grants, like, you know, or do you see value in this like state agency system? Like, you know, where are your priorities? In April and May, then we'd probably be reaching out to other people and sort of finessing that idea. So this could include community-based organizations, other state agencies, other divisions within OHA, kind of other people that would be impacted by your idea, and trying to figure out what their feelings and thoughts are about it and what we need to consider. We could do some community feedback if you wanted to. That could be, you know, conducted in a number of different ways. But really, we need to be kind of incorporating all of those final changes as the final package needs to be submitted by July. And then from there, we kind of wait and see if this is something that OHA wants to pick up and send to the governor. And then the governor has a decision to make. And then, you know, there are lots of other things that can happen between now and next January, when hopefully the package would be introduced in session.
So what I'm hearing is that the partnership would like for this to be taken back to one of the subcommittee meetings. So we've been hosting a couple throughout the month in between partnership meetings. And so why don't we do that? We'll take this back to one of the two, either policy or either finance, and have even both perhaps take a look at it and then add some dollar amount pieces that I heard Kurt, you offer that suggestion. I think that's real good. And then perhaps send it back out to the entire partnership again. So getting closer to the end of March and trying to capitalize on some of that, and then perhaps put it back on the agenda for April so that we continue to do address parts of the work. Does that sound reasonable to folks? Alicia, I see you're having your hand up. Go ahead.
Yeah, I'm wondering if we would need to have like a joint committee meeting. We have the policy and finance committee come together and work on this, because I think it would be really difficult for the policy committee to come up with the number.
Yeah.
Based on, what we're seeing from the need and the kind of dream.
Yeah,
and how
great
to
idea.
implement it. But then, vice versa, finance committee kind of being hard to kind of put a number on something when they really don't have the context of what the dream is. So that's something we can do, and that'd be great.
Yeah. I really like that idea. Why don't we think about putting that together, looking at schedules and stuff. So OHA team will follow up and try to find a collective time where those two committees can kind of come together, maybe a couple different times through in the next month before our next meeting.
Yeah,
So,
and then we'll also have the May meeting where presumably we'll have some more time to talk about this with the full group too.
Great. Great, thank you. Before we go into our break, I'd like to just quickly address, I know that at the beginning of the meeting, we had announced that the May meeting would be in person. And I know that that had raised some concerns for some of you folks. I want to assure you that nothing is in stone at this point. And so I want to actually ask and request that anybody please reach out to me so we can have that conversation. I don't want anybody to walk away feeling unheard or unseen, because I think there's a lot of work that we can still do as a group to formulate a successful meeting that can accommodate folks for May. And so I want to throw that out there. And I know that that was hard for some of you folks. And so I apologize that that was so abrupt. And so please reach out to me and we can definitely discuss more about that. And we'll take that back to the guidance committee as well. So with that, why don't we take, we're at 2:07. We want to give our folks, our presenters, at least 40 minutes. So how are we doing on time? Would folks 2:15? Is that too much time? 2:15. Let's come back at 2:15. Thank you, everybody. You can leave everything connected, and 2:15 we'll resume. Thanks. All right, welcome back, everyone. I have that it's 2:15. We're going to go ahead and enter into our presentations this afternoon. I want to welcome Grace Bullock from the Oregon Department of Education and Jesse Egan from OHA. I want to say thank you to the both of them for their patience in the presentation time, and we're going to turn it over to both of them. They can do introductions if you don't mind as well. I believe, Grace, you're up first, or is it Jesse? Grace.
Grace
Or
was
Jesse.
going to go first. I know she also had another commitment, so I'm hoping that she is here. I haven't double checked.
Oh, I apologize.
She was going to come here as soon as she could.
Okay.
She is logged on.
Oh, good.
So
I'm here. Sorry. I couldn't find my mute button.
Thank you, Grace, for your patience. So why don't we start with you, Grace?
Sure, you have my slides, correct?
Yes.
Awesome. All right. Okay, well, thank you for the invitation to spend a really short amount of time sharing out with you about what the Oregon Department of Education is working on right now to support the mental health and well-being of school communities, including students and staff and families. Just wanted to let you know that this is just a small, short snapshot of the work that we're doing in collaboration with the Oregon Health Authority. You'll learn a little bit more about their work when I'm done. But again, thank you for being willing to listen to us today. So next slide, please. Really briefly, I want to give you a quick orientation to the model that our agencies are using to orient our work. And the model is called the Integrated Model of Mental Health, and it's just as it sounds. It integrates 4 really important pillars of practice. One being strengths-based, so making sure that all that we do is focusing on strengths and the ways of being and knowing of individuals and school communities, and not reinforcing dominant culture models. Second, that we be trauma-informed in all that we do. Third, that we are making sure that all of our work is equity-centered, and that we are using some of the best principles and practices of social emotional learning. I must note that we see mental health as occurring along a continuum of care. So it's important to recognize that without things like food and shelter and caring and connected relationships, safety, security, that it's very difficult for students to learn and the teachers to teach. So mental health is really embedded in all of the social determinants of health when we think about promoting mental health and health in general within schools. So this model really frames the way that we do work, and the work that we are doing that I'll share with you next is how we see this work being embodied in school communities. So I could give you lots of different examples of how we're doing this work, but I wanted to focus in the short amount of time that we have with you today on a $5.5 million initiative that we launched a couple of months ago called Strengthening Mental Health and Education. And this initiative has 3 primary components, and they are designed intentionally in response to what we have heard through continuous and ongoing engagement with school communities over the last couple of years, and are strongly being responsive in the best ways that we are able to all of the needs that we're hearing from school communities. And one of the major considerations that we are hearing, and I think that this applies whether you're in school communities or in community-based mental health, is that we have a considerable workforce shortage. We have great difficulty, that's my dog, sorry. We're having great difficulty, not only as a state, but as a country, recruiting and sustaining master's level mental health professionals to serve the needs of youth and families, adults, individuals of all ages and all stages of life. So that is a major concern. And this initiative is designed in large part to find creative and innovative ways to, as rapidly as possible, provide scaffolding and infrastructure for school-based mental health so that we can address some of these needs. So the first piece of this is increasing mental health literacy across the state. As many of you know, in the mental health field, often mental health gets equated with mental illness. So when we hear things about mental health, we often think about fixing what's broken is one way of putting it, but we're focusing more on what's not working than what is working. Sadly, what that has done both currently and historically is it means that we are focusing on a deficit-based model, and even just the idea of a deficit often creates alienation and stigma around mental health concerns. So we want to really change the narrative about mental health to focus on promoting health, but also recognizing that, particularly in the last few years, many of us have learned that we are not omnipotent islands, and that we do need to ask for help, that sometimes the stresses and the strains of life are greater than our own individual resources, and it's important to know that asking for help is okay. And so the mental health literacy piece is a digital asynchronous, which means you can do it whenever you want, online platform that has been created by SAMHSA. I'm sorry, I cannot remember what all of it's a Substance Use and Mental Health Administration. It's a federal entity. And the Mental Health Technology Transfer Center. And we are working in collaboration with them to build an Oregon-wide digital learning platform for students, families, staff, administrators, but also for community-based organizations that serve school communities, so that we can shift the conversation away from that deficit-based mindset to really focus on how do we promote health, and also how do we do it in a way that honors the ways of being and knowing of all members of the community, because many communities have beautiful ways of promoting mental health that have been used historically that have not been formally recognized by the Western mental health system. And it's important that we shift that as well, so that we are duly recognizing and appreciating all ways of being and knowing that contribute to mental health. The second piece, which we are working on with the Teacher Standards and Practices Commission, which is the entity that provides credentialing for teachers relative to their professional learning, is to create, again, in alignment with our model, strengths-based, equity-centered, and trauma and social emotional learning informed mental health support professional learning opportunities that are a slightly deeper dive into things like how do we provide, or how do we create school cultures and climates that are welcoming, inclusive, trauma-informed, etc. And again, these offerings are going to be available to, thank you for that acronym spell out, that are going to be accessible not only to school communities, but also to community-based organizations that serve school communities. We are working right now with the University of Oregon as well to figure out what that looks like. That will probably be the third thing that comes online. I should have mentioned for the mental health literacy piece, we are hoping to beta test that in the summer and have that available to school communities this fall. It's a big lift, but I think it's doable. And last but not least, and I'm sorry, somehow our words got a little squished here on the slide, but is what we're calling our community care coordinator pilot project. And we are working with 3 to 4 school districts across the state, all of which have existing embedded linguistically and culturally responsive family support specialists. One is urban, one is rural, and one is frontier. And the fourth, if they come on board, will also be serving a rural community. And their family support specialists, who we've engaged with a lot, particularly in the last 2 years, have been telling us that their role as linguistically and culturally responsive people embedded in school communities in school buildings is extremely important to the community, but they don't feel as though they have sufficient education and training in providing mental health and social and emotional supports to families. And so we will be working very closely with these districts and an evaluation team throughout over the next 2 years to determine what type of family support specialist with additional mental health training could be of most benefit to these communities. We're going to be piloting those positions, creating an educational pipeline, I believe probably through local community colleges, and working throughout the process to figure out where these positions fit within the system of school-based and community-based mental health, and then kind of work our way out from there with the ultimate goal of partnering either with community CCOs, here we go again, coordinated care organizations, or writing specific legislation to fund these positions in the long run so that we can build out this infrastructure. I will say that at this particular point in time, we are focusing on elementary schools, in large part because we are seeing more families that are reporting difficulties with system navigation in early childhood, trying to get their kiddos assessed and get early services to them so that we can prevent later issues downstream. So those are the three main pieces of this initiative. And I believe I have one more slide. I think I do. And just to draw your attention to, this is the landing page for ODE's mental health and well-being resources. We have a mental health toolkit. We have lots of guidance resources. We have, again, a page, which you just saw in the initiative. And then we have a Caring Connection campaign, which we launched last fall, which we are continuing to support to help school communities build care and connection, and again, to promote youth mental health. So I don't know if you were planning on questions now, but I can wait until Jesse's done and we can do them together.
That would be great, Grace.
Okay.
If you can hold on for another 15 minutes, that'd be awesome. I appreciate you.
Yeah, thank you so much. Thanks for your time, everyone.
And Jesse.
Hi. If you want to go ahead and just scroll down a little bit. I'm Jessie Egan. I am the manager for the Child and Family Behavioral Health team at OHA. I use she, her pronouns. I was asked to talk about our investments as a child and family team, as well as some of the challenges that we are facing, and then, if possible, touch on some ways that folks can get involved. So I'm going to try to do that without talking too quickly, but I wanted to give a little bit of a kind of an oversight of a little bit about what our unit does. So there's a couple of slides where I'll touch pretty quickly just on sort of that continuum of care that Grace mentioned, kind of what that looks like in Oregon, just as kind of a broad background about like how the system sort of works. And then talk about the investments, challenges, and how to get involved. Hope I have 15 minutes. Is that right, New and Christy?
Yeah, we'll give you about 5 minutes towards the end just to wrap up with questions. I know it's not a lot of time.
Perfect. I'm going to do my best to get through a lot of material, but not talk too quickly so that I lose folks. I'll see how I do. So if you want to go to the next slide, this is our unit. For the most part, it's split up into subject matter expertise. So we have kind of 1 or 2 people working on different parts of the system, kind of across all of the different aspects of child and family and the kind of youth and young adult mental health. And we work really closely with a lot of different agencies. We work very closely with Grace and her team, as Grace was saying, looking at using schools and really thinking about schools as like prevention work is a huge part of what we do. So I'll talk about that as part of the continuum of care. But we also do work with the Department of Human Services, the Oregon Youth Authority, Public Health Division, OHSU. So we really have a lot of places where our work kind of touches other giant organizations, because we do work with all children from the ages of 0, so infancy, all the way through. Some of our programs do go through 25. And we also have a person on our team who part of her job used to be as a tribal liaison. So she's an intergovernmental kind of bridge between the government, the state of Oregon, and the 9 federally recognized tribes of Oregon, who are recognized by Oregon as a separate government. Now that's 100% of what she does. So she works with our team and then also with the tribes, because there is a specific tribal behavioral health initiative and plan. So she helps sort of bridge those two worlds. And the only other thing that I wanted to just say is we use the term behavioral health, and that really is designed to kind of encompass both mental health, including prevention, and then kind of mental illness once folks have actually got a diagnosis of some sort, and then also be inclusive of substance use disorders. So there's a person on our team who works with that as well. All right, let's go to the next slide. So this is the continuum of care, sort of in order from the kind of the broadest, the least restrictive. So we do mental health prevention and promotion. A lot of that work is in schools and in communities. We work on anything from just teaching children about what social skills are, what mental health is, how to talk about feelings, some of those really basic pieces that are pretty broad. And then substance use disorder prevention work, starting as early as we can, making sure that we are doing the kind of proactive pieces to avoid getting to the place where people need kind of more intensive treatment. And then suicide prevention, education, and postvention. And the folks on our team who really do a lot of suicide prevention work see all of that as being prevention. So anything that we can do to teach people about how to talk about their suicidal thoughts, teach communities how to work with people who are feeling suicidal, doing that education, breaking down those stigmas, and then even if we do, luckily it's relatively rare that we lose a young person to suicide, but if we do, we also want to make sure that we get into communities and we do really robust kind of what's called postvention work. So trying to make sure that we help support communities and try to prevent any further death by suicide. So that's, even though something terrible has happened, really making sure that then we use that to do further prevention work. And then, so those pieces are sort of the prevention. The treatment pieces are actually once someone gets a diagnosis of some sort, there is then still a continuum that of the different services that children and young people can access. Starting from early childhood, there's infancy and to school age work. We do school-based mental health services, so there are folks embedded in schools. There's more intensive community work where we are trying to do everything that we can to keep children and young people in their families, in their communities. So there's intensive in-home work, there's day treatment work where children are in sort of what looks like a school day program, but living at home, and then the residential levels of care. And then the other two pieces that our unit does is restorative services, which is when young people have been referred into the mental health system through a connection with juvenile justice if they've been accused of a crime. And there's a question about whether or not mental health issues might be getting in the way of their ability to engage in the court process or defend themselves in court. Then we support that, and that's both in community, and then if there's some sort of threat, if there's a fear that they're not going to be safe in the community, that can move into an inpatient setting through a judge's order. And then we do work with young adults all the way through age 25, and that can be, we have some young adult sort of transition age youth homes where there's folks that are maybe just needing a little bit of extra care. Turning 18 is a really big transition, and not everybody's ready to just fully adult all of a sudden. So we have programs that are designed to sort of help bridge that and provide some extra support. And then our early onset psychosis programs help to support young people who have experienced their first episode of psychosis to really provide community support, and that goes through all the way through 25. So that is the continuum in a 30-second kind of update. Hopefully that all makes sense. And if you want to go to the next slide, this covers the beginning of some of the investments that we have in progress. So as Grace mentioned, as I'm assuming everyone has a little bit of an inkling, there is a major concern about the workforce available currently for behavioral health, for mental health programs, for substance use programs, but really that is not unique to behavioral health. That goes all the way through the entire healthcare system, our schools, really our whole kind of society, both in the US and kind of across the world. There's workforce shortages. And so there's a lot of work happening currently around behavioral health workforce, working to increase wages, which we've known for a long time have really lagged behind physical health providers. So there are we were talking about legislative concepts and laws, there's actually a new law that has passed just recently in this legislative session to provide additional funds. And kind of beyond that, OHA is really building in a whole team of people to look at workforce. What does it mean to bring more people kind of broadly into the field, but also looking at a really diverse workforce, trying to make sure that we have providers that look and are from the community that the people who need the services are coming from. And so people always have a right to have a provider that looks like them and is part of their community. So we're trying to really make sure that we've got a broad recruitment effort, and then also what can we do to make sure that we retain folks in those positions, because what we know is that turnover is very high. Some of these jobs are very, very difficult. And so really looking at what we can do to support them, make these living wage jobs, make the work a little bit, I guess, more supported so that we can keep people in the field for a little longer. That's a lot. And that's just one of the pieces. So Oregon has embraced the system of care. And so each CCO is required to have a system of care process. And then in addition to that, there is a system of care advisory council that was built into legislation in 2019. It is representatives of CCOs and funders, but also young people, family members, providers. Grace is on it, really looking at kind of across the board, how can we have all of the different systems that interact with children working together to create a plan, to really make sure that we're all kind of communicating with one another to work toward the best interests of children and communities pretty broadly. The next is interdisciplinary assessment teams. This also came out of legislation in 2019, but wasn't funded until 2021. So this is really trying to bring assessments into places where children can access them, mostly looking at our kind of most complex kids, children that are maybe bouncing in between different levels of services, children who are in foster care, where the team is really struggling to figure out what might be the best interaction, the best kind of interventions for a child or in their situation. So we are trying to figure out how to get those assessments really quickly to try to make sure that we can build a plan, figure out kind of where the complexities lie, what would be the best intervention, and then have those folks who are doing that assessment remain in the child's life to really build a bridge to the providers so that the children don't fall through the cracks, because what happens is when kids are bouncing between different providers or different families, sometimes there's just not enough communication between those folks. So that is in process now. We were able to hire someone about 4 months ago for that position, and he is getting his feet under him, and he is trying to get a pilot started as soon as possible. It's a pretty huge need in the community at the moment. And then we have a lot of investments around data and metrics. They're kind of Oregon in general for behavioral health and for children's mental health specifically. We really don't have the information that we need. What we want to do is make sure that we are able to reach out to communities that haven't been served, that we know are facing just disparate health impacts of COVID and all of the things, as Rachel was saying earlier, all of those things have been present for a long time. We've always known that there were disparities, but COVID really brought all of those things front and center. And we get questions around, well, how many children or how many families are being impacted in these ways? What is their representation of where they live, what the diagnoses are, what their racial and ethnic backgrounds are, and how can we support them best? And if we're being honest, the state just does not have that sort of robust data available to us. So we're working really hard on a lot of different ways to try to centralize access and make sure that we all know how to get people into care when they need it. We've got some additional staff who are coming on to work with our unit. We're looking at how often children have to use the emergency department in order to get their needs met, because that's a huge issue in communities. And then also just for our own unit, really looking at building a really robust data dashboard so that we can track information over time, pull in all the information from other places, and do everything we can to try to build in as much information so that we can make really smart decisions. Okay, next slide. Here's more, and then we'll talk about some of the challenges. Everything that we know about residential services is that we want to do everything we can to keep children out of really intense level of care. Residential treatment can be incredibly difficult for the children and the families who need this level of care. And I think that's why we do a lot of the prevention work, why we're trying to have services be in the community. But what we also know is that there always are going to be some young people who need this level of care, and we want that to be available. Workforce concerns have really taken a toll on residential capacity in Oregon. Even before the pandemic, we knew that we did not have enough of these services available. And what we have found is that during the last few years of COVID, we actually lost capacity. We have fewer residential beds available. So we have $7.6 million have gone out to try to help these programs stay in investment. We have paid for open beds when needed. We're really trying to do everything we can to work with them, to do a rate study, to really make sure that these programs are funded as well as they need to be, so that the staff can be paid as well as they need to be, so that we can serve the children and families in ways that are culturally and linguistically appropriate for the children and families and whatever their unique needs are. It's a really complex level of care, so there's a lot of work that's going into that. Yeah, there's so much. There's workforce study trying to figure out where to find these folks. So there's a lot of work going on into residential at the moment. And we also have some expansion. We're looking for proposals for transitional age youth homes. We do have some of those homes, like I mentioned, but the demand for that level of care is very high. So we are trying to expand that. And there is a new level of care, kind of a new process going into place in July of this year called Mobile Response and Stabilization Services. I won't say a ton about that. It's probably a whole half-hour presentation unto its own, but it's a huge investment, and we'll be really connecting with the 988 behavioral health crisis line that is rolling out across the country. That goes into place in January of 2023. So we are trying to kind of get ahead of it and make sure that there's a robust crisis and stabilization process for young people and families, so that when 988 rolls out, that is available.
Jesse, thank you so much. I'm going to have you pause for a second. There's a bunch of questions. Yeah, there's a bunch of questions already. And so I want to make sure that we give you folks time, both you and Grace, time to answer some of those questions, because I want folks to hear it from you, you both. So there was a couple questions in the chat. The first one, Alicia, do you want to ask your questions for Grace? And then let's just go ahead and jump right into some time for a question and answer while we have our guests here.
Okay, hold on. Yeah, I have a couple questions, and I am absolutely open to, have these maybe just sent in an email back or whatever. That's totally okay. I guess my first one is, how will the feedback regarding the effectiveness of the community care coordinator pilot project be gathered? In particular, what I'm interested in is how or what role family and student voice will have in this process. Is what I've seen a lot of times, especially in the kind of in the education piece or in the education world, is that, okay, well, there's a whole bunch of people working together doing a lot of great things. And at the same time, there's a lot of times there's very little family voice that actually comes through. So I guess that's my one question, is because having a family coordinator is actually one of the biggest things that I've heard family members saying that is a need. And it's actually something that we in Yamhill County were really, really kind of wanting to push ahead. So I'm curious about, what role the family voice will have, or family and student voice will have in this. And then also, what are the next steps in terms of implementing this project to the rest of Oregon districts? Will it be, what are the metrics in terms of, okay, well, we'll move forward with letting, or, having, implementing this to the rest of Oregon districts, or, okay, well, no, we have to revisit it. And the next question is, how were the 4 districts chosen that are currently the kind of the select districts? And are they really representative of the needs and gaps and services of especially rural areas, or the rural choice that was selected, or is kind of the rural one more of an outlier? That's a really good one, really good district, and they've already have a lot of the things in place. Or is it actually representative of a lot of the rural districts that we live in? The other question is, I did hear that this is again focused on early learning. So it's again, elementary school is being prioritized, which I absolutely think it's necessary, but I also am really concerned that middle school age youth will again fall through the cracks. And that is something that I know, I have heard from many family members, that they just don't know how to do the same things. So the same things that were being addressed here for elementary school students, same thing happens for middle school age students. So I guess that's and then I guess a follow-up question to that, are there any plans to integrate middle school age youth into these pilot programs over the next 2 years? So again, I'm totally open. Or follow up later because
And
that is a lot.
let's make sure that all of the questions, you know, if we don't get them today, folks, we'll definitely follow. We'll have both Jesse and Grace follow up with answering it in an email for all of us, and we'll send it back to the partnership group. So Christy and I can make sure that that happens. So if you want to, you know, tackle one of those pieces, Grace, that would be great. And then there was several other questions for Jesse as well. So go ahead.
Yeah, I think they're, you know, thank you so much, Alicia. All excellent questions, and in many ways they're quite interrelated. So maybe I'll try to get to as many as I can with a reasonably short answer. But again, it's a complex project. So great question about the feedback. This initiative was based largely on the feedback that we've been receiving over the last couple of years as a starting point. But what we are doing, so I come to this work with a bunch of different hats, one of them being a program evaluator, and I understand the need of embedding our evaluation team right from the very beginning and making sure that we design the entire initiative with the intention of having school community members, and that includes, you know, students, staff, families, providers, school administrators at the table to develop this thing. So we're not just going to build something and say, gee, I hope you like it, what do you think? But actually design it with communities, because I think that, you know, in the absence of that, we could be just completely missing the mark in terms of identifying what's needed. We are hearing, as you are, that family support specialists really are needed, but, you know, with local control being one issue in school communities, and also there's such great diversity in districts in so many respects, and the one I'm referring to in this particular case is mental health service delivery. It's so different that we really need to build each one of these with the individual communities, and then look at what are the commonalities and what are the integrity points around this work that we want to preserve, and where are the places where communities can design and create their own positions that fulfill their own needs. So I guess the short answer is we'll be involving everyone in the school community throughout the process. And our end goal is not, in this part, it's not to evaluate whether it works like a formal outcome evaluation, but to understand the whole process of creation so that we can replicate it. And also so that we can provide, so to your next question about scaling, we need to provide proof of concept that this actually is a viable solution and that it works before we can propose to spread it, you know, further across the state. So, and we also want to understand it well and deeply before we scale it, because there's no point in rolling something out that doesn't work. So we want to make sure we're very intentional about making sure that it works well before we do that. How are the 4 districts chosen? They were chosen based on a number of factors. We actually focus a little bit more on schools than districts, but we wanted to make sure that we were getting as much. So we intentionally chose, you know, urban, rural, frontier, etc., based on a desire to make sure that whatever we create with them together, that it's going to be applicable to all these communities. So there was a lot of racial diversity was a main consideration, whether or not districts had a history of engaging communities well, because we didn't want to start right from scratch, because we just did not think we had, like, in 2 years, we cannot build all that relational trust from scratch. So we need to understand what it takes to build that relational trust and learn from our communities, and then take it to communities that are less well established in terms of those relational components with their districts, and be able to work with them to figure out how do you create that. I absolutely hear you about middle school. If I had more money, I would do. But I think, you know, maybe Jesse can address this, but they are doing a lot of really good work with older kiddos, particularly in suicide prevention. You know, coming to this work as a psychologist, I absolutely appreciate the transition to middle school and how middle school is a vulnerable period. That is something that we're wanting to address, but we needed to be very intentional in this initiative about where could we affect the greatest change. And what we were hearing from our districts and our families and students was that earlier period of childhood was where the primary prevention efforts we think would be most impactful. I don't know if you want to
Thank you,
add anything to
Grace.
that, Jesse?
I think I'll probably just leave it there because there were a couple other questions as well. You were kind of jumping in, so.
Oh yeah, I was gonna say, Jesse had put in another link to get more information. That's ways to sign up for a newsletter. I want to throw the question to Kurt. I see that you have your hand up, so I just want to acknowledge you real quick. And then all those questions in the chat, we're gonna record those and then email you the answers from our colleagues here. But Kurt, I do see you have your hand up, so I want to acknowledge you. Go ahead.
Thank you, and I'll make it very quick, Dr. Bullock. And Jesse, thank you so much for your presentation. Very, very informative. I just have a couple of thoughts. Is when we talk about linguistic and culturally appropriate, I definitely would hope disability culture is a consideration. And that more collaboration around the disability advocacy centers for independent living in Oregon, connecting these young people with disabilities with these disability advocates. The mental health wellness resource page, I definitely hope they contain community-based organizations so that we can increase the collaboration. Third is the power dichotomy. I hope that there's some self-determination written in, self-choice, self-directed, and definitely peer advocates to help represent those students with disabilities, living with mental health disabilities, all types of disabilities. Last, number 4 is the transition aged youth homes. Definitely, I am familiar with that model in California, not so much in Colorado. And I know across the United States, and not even the United States, but internationally, sometimes these homes have very nice names to them, but they've become many institutions. And I definitely hope that there's a peer advocate in place. I've seen that in Idaho, where a young man entered one of those homes, and I'm pretty sure the definitions are different. You just kind of went over those. But now he's got 6 or 7 different diagnoses. He can't get out of those homes. It has just been a nightmare for him. So I'm hoping that definitely peer advocates are involved. And last, collaboration is the key. Department of Education can't do everything by themselves. Community-based organizations, we can't do everything by ourselves. We need to have more collaboration. And sometimes these requirements of service collaboration, coordination has to come in regulations or Department of Education directives, because those are most important instruments to contributing to the coordination in the local communities. Sometimes it does have to come from the top down to the local communities. So thank you so much for a wonderful, informative presentation.
Yeah, we have a lot of questions within our chat room, and clearly we will need you to come back, both Jesse and Grace, to offer more in-depth responses, and then offer more ways that this group, the partnership, can be involved with what you're doing, and then how our key priorities are connecting with the work that you all are doing. I want to offer up all of the pieces that both Connie, Alicia, it looks like Rachel, you had some questions in the chat as well. We'll get those responses from Jesse and Grace back to you all and to the entire group after today's meeting. I do want to recognize that our next meeting will be Monday, April 4th. Please contact me if you have any questions about the next meeting or comments about May's meeting. We also want to remind folks that the invoice template for getting reimbursed for all of your participation and work is posted in Basecamp. So please fill those out and send those back to us as well. So with that, any last comments or questions before we close out today's meeting? Oh, applause sign. Thank you, Kurt. Thank you all so much. thank you for your time, and we'll connect very, very soon. We appreciate everything that you guys have been doing. And thanks for your patience today, everybody. See you next month.
Bye, everybody.
Thanks, everyone. Take care.
Bye.